When considering tooth contours, especially those of anterior teeth, two aspects always have to be taken into account. On the one hand, the functional aspect, because, like the posterior teeth, the anteriors are functioning teeth, and on the other hand, the aesthetic aspect. As anterior teeth fulfill functions, their contours adapt to their function, or their function to their contours. These are the anterior teeth of a 6-year-old boy. The upper deciduous dentition is still complete, and the lower permanent teeth are beginning to erupt. These teeth are considerably larger and broader, and their incisals are more prominently structured than the abraded deciduous teeth. The same boy a few months later. In the meantime, the lower anterior teeth have all erupted, and the 4 upper anteriors are in the process of erupting. Take a look at the bizarre and abstract shapes of the incisal edges. You can imagine what still has to happen before these teeth look as we would expect them to later. It's interesting to note how bizarre the incisal edge appears with the tiny mamelons and the tubercles. The same boy 2 years later. The first abrasion facets can be seen on the anterior teeth. The incisal edges of the lower teeth have been levelled and adapted to the functioning of the upper teeth. The upper centrals have moved closer together, and the diastema has closed slightly. Due to an external effect, a section of enamel has fractured off the mesial edge of the tooth. Now the boy is 12. The teeth have closed up tightly, the diastema has closed, and the lower anterior teeth have abraded more. The mesial corner, which was fractured off tooth 2-1, is hardly relevant. Abrasion has smoothed the injured area. The teeth have grown out of the gingiva and are now ovoid-shaped as expected. This is a comparison of the congruent shapes of the upper anterior teeth. The deciduous dentition of the 6-year-old is shown on the left. The deciduous dentition's time has come. It's worn out. Amazingly, it is shaped the same as the anterior teeth in the right picture, which are also worn out. The fact that the teeth are shaped congruently indicates that their function really shapes them severely. Various members of a family will be used to show the changes which take place later. This is Benjamin's dentition. He is the 12-year-old member of the family. His teeth are hardly worn and look very youthful. The laterals and canines have also not yet been exposed to functional abrasion. And this is the 40-year-old uncle in the family. His 4 anterior teeth have been abraded noticeably in both the upper and lower jaws, but the upper laterals have only just been affected. This is the 50-year-old father of 12-year-old Benjamin. His teeth appear older. Their cervical regions exhibit severe lesions, and the incisal edges have been worn more. This is the grandfather of the family about 11 years ago, when he was 80. His teeth appear old from all points of view. Their cervical regions are very exposed and have undergone severe elution, and the incisal edges have been abraded. The incisal edge of tooth 1-1 has fractured completely. This is the same old gentleman 10 years later, once he had turned 90. The condition of his teeth had not changed particularly, but if we take a look at the mesial edge of tooth 1-1 and recall that a corner had fractured off, we can see that nothing is left because the remaining incisal edge has worn down to this level. This is the function and wear which takes place in 10 years. These are photos of an almost 80-year-old patient when she was young. She has a full upper denture and an implant-supported lower restoration and would now like upper implants too. Her teeth underwent amazing changes between being an attractive young girl and becoming a married woman. As the models just happened to be available, it was determined that an incorrect posterior restoration had allowed the bite to close, causing the anterior teeth to splay out. To compensate for this, the teeth were sawn out of the model and positioned in their previous locations in wax. An overcast was then fabricated with the plaster teeth in the corrected positions on the model and used for setting up the teeth. At that time, Volker Brosch had assumed that optimum aesthetics were required, as he had taken the patient's functional aspects into account and replaced the teeth where they had been positioned originally. But as the denture was still obvious, Volker Brosch took a closer look at the anterior teeth. What was the cause and effect? Tooth contours are more than just functioning shapes. They also have a three-dimensional character. Failure to understand this and take it into account results in the denture look. At the IDS, a little behind schedule, Dentsply de Tray introduced Genius A, the long-awaited new anterior teeth. Like the posteriors, the anterior teeth also have interdental marginal seats, which allow exceptional natural gingival contouring. The enamel dentine buildup of the Genius A is very natural and is complemented by the structural vitality of the surface. The natural harmony of the Genius anterior and posterior teeth provides the denture with impressive aesthetic qualities. The trial pack, comprising 3 sets of 28 teeth, costs 298 Deutschmarks. It is available in Biodent and Vita shades. At the IDS, Vita Zahnfabrik also introduced Physiodens anteriors, a new range of anterior teeth. According to Vita advertising, they're identical to natural teeth. This is no exaggeration. The demonstration models show impressive natural-looking dental arches. Looking at the teeth on the tooth cards confirms the claims about the product. The surface does not have the flat shape of a denture tooth. It has a well-structured and extremely natural appearance. The build-up, that is, the internal shade structure of the tooth, also contributes to the overall aesthetic effect with its natural transitions between the transparent and dentine sections. We can certainly agree with Vita and Dentsply de Tray that their new ranges of teeth are extremely natural looking.